No. Oh, that's you. Okay. It's okay. Over here. Before you let the people in, I can't find the, let's go to slideshow. Sorry. All right. Start. All right. And then, oh, there we go. All right. Hi, everybody. I'm Marianne Ryan, and I'm a physical therapist, and I specialize in pelvic health. And I wrote a book called Baby Bod to help women go through pregnancy and also after delivery. Let me just turn off the AC because it's background sound that might be irritating. Let me just see. All right, so we're going to talk about what happens to your body and what you can do about it before and also after birth. The tendency up until like 15 years ago was doctors would just tell you, well, that'll go away after pregnancy. They're becoming more and more aware that there's physical therapy treatment that can really indeed help women. And that's what I try to advocate. So I have a practice in Manhattan, and we do the Baby Bod program. And if you have any questions, the website address is right here. And I also would love for you to try to keep in touch. I am on Instagram. I also have a website that you can go, and there's tons of different blog articles that you can learn from. And Instagram, I'm extremely busy. I have tons of information that I give away for free. So you can look at me on Instagram at the Baby Bod program, and try to check out the TEDx talk that I did, where I talk about my experience as a mom and what I went through and the journey of learning how to treat women who've been pregnant and have long-term consequences afterwards. So I don't know if you're pregnant or not, or if you've just given birth, but it can be an amazing experience. It's also a great relief if the third trimester was as challenging to you as it was to me. But along with all the excitement, there can be some changes to your body that can have lifelong consequences unless they're directed. So dealt with. So one of them, which is great with Borum Care, is that they really focus on the immediate care, which the model is after following what they do in a lot of Asian countries where they do 30 or 40 days rest. I taught in China myself, and I taught the Baby Bod program to them. So they're kind of changing and having women become more active rather than just bed rest, which is great because just bed rest is not what I recommend. So some of the changes that occur in your body can cause things like pelvic pain. Now, it can be acute where you have some tears right after delivery, or just the rigors of delivering where the pelvis kind of gets a little bit wonky or kind of tilts. That can cause some pain. And hopefully that should resolve within about 2 weeks. I see a lot of women 1 week after delivery, even if they have a C-section, for a visit. I either see them in person or else we do a telehealth visit where we get them out of that initial stage of pain. But you can also develop chronic pain unless it's dealt with. And that's something that's pain that's beyond 3 months. And that's something that I definitely suffered with during my, postpartum period, along with some of the other things I'm going to be talking about. Now, a lot of people are aware of what's called diastasis recti, which we're going to talk about, and that's where there's a separation of the six-pack muscles, which is normal during delivery. Otherwise, your belly wouldn't be able to expand to to actually carry the baby. And then through time, hopefully the elastic part of your connective tissue system will bring it back together. But that doesn't just happen automatically for a lot of women. And then there's something called pelvic organ prolapse, which I'll explain. A lot of women have a leaky bladder, which I definitely had for many, many years. And I had to learn some behavior modification along with strengthening exercises once I put together the Baby Bod program. Along with that, some women experience sexual dysfunctions, meaning pain when they're having intercourse. And then, of course, because you've gone through pregnancy, there's a poor fitness level that you have to re-enter into, and you want to do that slowly. So a lot of people are surprised that the two things that you need to kind of focus on right after birth is alignment, or some people call it posture, and breathing. Those are the two main parts that are taught to that I use in the baby bod program as the first stage of recovery. So what you learned during pregnancy is to kind of tilt your rib cage backwards to make room for that baby. And in order to counterbalance that big belly in the front and carry that weight, you kind of have to tilt backwards. And after birth, you have these loose stomach muscles, you're taking care of a newborn, and you really don't have time usually to just say, okay, so I'm going to do exercises to start feeling better. You're exhausted. So one of the things you can do is restack the rib cage that's tilted backwards over your pelvis. So that includes a lot of the exercises and the form that I use in the exercise program, and it's something you can do right away. So think of it as the lower rib cage, which is right below your breast tissue. I'm not sure if you can see this, but what you're going to do is bring the rib cage, which is right below your breast, down towards the pelvis. So it's like a downward motion that'll help bring the rib cage over the pelvis. And if you feel your stomach muscles, you're going to feel a natural tautness that kicks in automatically. And that's the deeper core muscles starting to help support you again. When they're stretched out during pregnancy, they're kind of shut down and not working as well. And then breathing, because the baby pushes up against the diaphragm, full breath in the rib cage is also limited. And that's something that has to be addressed also. And I have some videos that are in this demonstration that you can practice. And I'm not sure if I guess that Borum's probably going to have this on their website or something like that, that you'll be able to go back to it. Because they're videoing this or recording this. So let's talk a little bit about pelvic pain. It can occur because of many different reasons. One of the things that I do as a physical therapist is I try to rebalance the pelvis. So from all the hormones that loosen things up, which is good because you need to have a looser pelvis to let the baby deliver through the pelvis, but that continues after birth, and especially there can be lingering effects of the hormones if you're lactating, that you'll still have some looseness caused by the hormones that are produced while you're lactating, just like during pregnancy. So you have to kind of be careful of it. And then as you walk even, you're supposed to have some movement, very minute movement in the pelvis, but this is exaggerated and can be painful. So that's the first thing that I address with women is alignment, breathing techniques, and also doing manual therapy to help realign the pelvic obliquity. And then I teach them very specific exercises on how to deal with that. And this Thursday, this week anyway, you might be listening to this on on a recording at a later date, but on Instagram, I have a whole post going out explaining what the steps are to rebalance your pelvis. And you can do a lot of the exercises that I do right after birth, even if you had a C-section. I don't believe in just sitting around. So some of the pelvic pain causes is first tissue injury from delivery, because a lot of women have tears. And that should resolve in a week or two. If not, if you're still having pain, like I had a patient recently that she was still having pain at 6 weeks. She was a doctor, and so was aware of the body. And it turned out that her tear wasn't totally healing. So she needed something called silver nitrate, which the doctor put on the wound. And within a week, it started rehealing and was much, much better. So complain if you're experiencing any pain beyond 2 weeks. There is treatment for it. Even after a week, if you have a good physical therapist, have them work with you. Also, the pelvic floor muscles are strained because of the stretch and the push of the baby. They can be strained and in spasm. And when that happens, when they're strained, they're weaker. So that it can cause things like, pain, also, urine incontinence, fecal incontinence, things like that. So that's something that sometimes women have to learn how to first relax their muscles before they start doing Kegels, which I don't have people really concentrate on, because after birth, a lot of times the muscles are really, really tight and they need to learn how to elongate in order to contract fully. So that's another caveat to your recovery. So with pelvic obliquity, I'm going to go back to this picture. You have different joints in the pelvis. So there's an SI joint on either side, and that can feel like low back or even buttocks pain. And then you have the pubic symphysis, which is this huge cartilage that's in the front of the pelvis. And that can cause pain when you're walking forward, doing one-legged activities like pushing a heavy box, or even swinging your leg to get over a bicycle, going up on a ladder, even stairs. It can cause pain. So there's treatment for that. And I don't go into the details of the treatment, but you don't need to live with it. And if you need physical therapy, if you have somebody who's experienced like I am, you don't necessarily need tons of treatment. But what I do for my patients is I identify what the problem is, and we actually video. Usually it's 3 or 4 steps that they have to do to mobilize the pelvis to get it back in shape again and working more optimally. And that can reoccur even throughout the day. So it's like if you do this 2-minute thing or even a 1-minute thing, depending on your dysfunction, you can start, one, getting out of pain, and 2, functioning more optimally. And no matter what your doctor says, physical therapy can help resolve pelvic pain and a lot of the other problems. I still have doctors who are telling people, like I had this woman who started last month. She was only 3 weeks postpartum. She was in some pain, and she brought herself to physical therapy. Her doctor didn't recommend it. And we started and I saw her, and I'm still seeing her. So at her 6-week checkup, after seeing me 3 times, she was out of pain. She was feeling much better. And her concern was that she was having a lot of urine leakage. That started resolving and is going to continue to resolve with the strengthening program that I'm giving her. So she said to her doctor, "Do you think I should do physical therapy because I'm having urine leakage?" And the doctor actually said, no, it'll go away, which is the wrong advice. So be your own advocate. That's why I wrote my book, is to help the consumer become more aware and understand that there's treatment, just like the wonderful care you can get if you're involved with Borum care. Another thing that can happen after birth is called diastasis recti. So what that is there's your normal stomach muscles. Everybody wants to look like that, right? What happens, in order to make room for the baby, the six-pack muscles spread. And in my book, I talk about this spread, but I don't talk about how the fingers can kind of go in, and the softness in between the 2 six-pack muscles, which was newer research that came out after I published my book. So what that looks like when I test women for it is, if you can see, this is somebody's body. These are fingers going into the diastasis. So what you do is you put your fingers in to see how far they go down, and then you lift your head and do a little bit of a lift, and hopefully the fingers should be pushed back up. If not, then you have a lot of work to do to get the deeper muscles, which are the part of the core system, to activate or start, and work to help hold you together. And there's treatment for it. So don't let anybody tell you anything else. So tips, if you have a diastasis, which everybody does right after birth, otherwise you wouldn't be able to accommodate the baby. Some women have a pretty good recovery where, 6 weeks later, the stomach muscles are lined up and they don't have that much tissue softness, but that's unusual. So some of the tips that you want to do is, one, a lot of people are into wearing tight abdominal binders. There's, I forget the name of the company, but there's this thing that Kim Kardashian was trying to sell, that it's a tight abdominal binder that you wear. And there's even like another exercise program where you're supposed to wear it for a month or 2 and do all these exercises. And you might get immediate results, but once you take that off, within a day or 2, you're actually going to have the same diastasis return. So you're really not recovering it. And it also, wearing a tight abdominal binder will weaken the muscles in the long term. So you don't want to do that. So what you can do is do things like wear not a Spanx, but like a tighter tank top, and have it come all the ways down, to your pubic symphysis area, which is the beginning of the pelvis in the front. And try to wear that, and it should have enough elasticity to remind the muscles to work, but not so much that it takes over like a Spanx or compression underwear. The other thing you want to do is to try to avoid straining your abdominals by doing too much too soon. So an example of that is lifting up the stroller when you're only a week or two out. What happens is, in order to lift it up, it's just like, if you ever try to open up a jar and you kind of hold your breath because of all of the it's really hard, so you hold your breath and that makes the belly expand, and it also has downward pressure going down against the pelvic organs. You don't want to do that, so you want to gradually go back to doing things like lifting. We're going to talk a little bit more about it, but you want to avoid that breath holding behavior. So when you're lifting something, even a pot of heavy water, when you're making some pasta, pull the pan towards you so that your arms aren't straight out. So pull the pan towards you, or the pot towards you that's filled with water, and then, go ahead and drain it in the sink instead of just lifting it up and holding your breath. So as you're lifting, though, you want to try to exhale and try to get into that habit, even though the newborn babies are maybe 7 pounds and you don't think it's that much, but after a while they get bigger and bigger. And as you're lifting a baby, as they're getting heavier, you can just like tighten up your stomach. You can even hear me doing it, and that's going to work against you. And again, you need to have a gradual return to fitness, not, this is what I was able to do before I was pregnant, so I'm going to go ahead and run 3 miles. I've had a lot of people who've had problems with that. So the other key thing that I want to talk about here is not holding your breath, which I was mentioning before. It can lead to a lot of problems. And what it is that as you hold your breath, there's pressure that goes downward and it pushes the pelvic organs downward and also the abdominals outward. So you want to try to avoid that. So as I was saying before, exhale when you exert yourself. The amount of the exhale should match the activity or the task. So if you're picking up your little baby who's 7 pounds, it's just a little exhale. But if you're picking up something much heavier, like a 15, 20 pound grocery bag, which I hope you're going to wait a while to do that, you want a bigger exhale so that you're not expanding in the belly or pushing the pelvic organs downward. So some of the behavior of pushing the pelvic organs downward can make something called pelvic organ prolapse worse. It's very common that women, right after, maybe it's a third of the women who deliver, that they experience the pelvic organ looseness where it starts to migrate downward. And I've gotten phone calls, oh my God, I feel like I have a golf ball in my vagina. And I took a mirror and I can even see something. And that can occur if you're doing too much too soon. I had a patient who was an athlete. She was great right after birth. I actually saw her. And then she was going back to her exercise routine very early on. She lived in a walk up. She walked up about 3 flights of stairs where she had carrying heavy grocery bags. And this is when she was maybe 8 weeks postpartum. So suddenly, when she got to the top of the stairs, she lost all of her urine, so she lost control of that. It doesn't mean it was permanent, but she also felt something coming out of her vagina, and that was the pelvic organs being pressed down by the behavior of holding your breath or, using that pressure to kind of stabilize rather than having the muscles to do it. So it's something to consider, and that's where a good physical therapist can help you. Constipation, big thing. During my day, we weren't allowed to leave the hospital until we passed a bowel movement, and they gave us then and still give people things, to help loosen up the bowels or soften them. And one of the things they might give you is called Colace. So when you have constipation, what's going to happen is that there's an increase in that intra-abdominal, the pressure inside the tummy, and that pushes the pelvic organs down as you strain. So you want to do things like make sure you're having a diet that's high in fiber, drink plenty of fluids, consider doing stool softeners. Some women take probiotics, and that helps to soften the stool enough. Other people use magnesium. So there's a lot of things you can discuss that either with your doula, doctor, somebody, who understands it, to keep things flowing instead of having to strain. And one of the things that you can do to help prevent the straining of constipation is to use better toileting habits. So this is an example. She's just sitting on a toilet instead of a chair. I mean, she's sitting on a chair rather than a toilet. Is when you do try to pass a bowel movement, what you want to do is sit, knees should be higher. You can use the squatty potty or yoga blocks. So, some of my patients just turn their garbage pail to the side, elevate their feet so that their knees are higher than their pelvis. And then you kind of lean forward a bit and you just breathe. And then hopefully the bowel movement will come out if it's soft enough and if it's not in there for long periods of time. Women also can get incontinence. So sometimes there's a temporary form just before delivery and for a couple of weeks after. But if it continues for more than a month, I would consider, if I was you, to think about getting some treatment for it. So there's something called stress incontinence, which is very common with moms. And that's the type of incontinence where you have some urine leakage when you cough, sneeze, jump, where you can have a little leakage. Some women even have, like, I get emails from people, oh my God, I just ran 2 miles and I lost all my urine. So it doesn't mean that it's a permanent problem, but it means it's something to address and there is treatment for it. And then there's a type of incontinence we call frequency. So sometimes women have muscle spasm in the pelvis after delivery. And unless they do things to kind of relax those muscles, get them to elongate and work properly, it can make you feel like you have to go to the bathroom all the time. And there are some behavior modification things that you can do to kind of learn to stop doing that, where it almost feels like it can feel like you have a bladder infection where you keep on have to go. And then once you start going to the bathroom a lot, your brain's going to tell you to keep on doing that, including at nighttime. So you want to do things to loosen up those muscles. Sometimes you have to do some massage work on the pelvic floor muscles. A physical therapist can do that, but there's also wands that they sell that you can do a self-massage to see if that helps. And then the behavior modification is learning not to always go to the bathroom. You can start saying to yourself, okay, I feel like I have the urge to go. Let me see if I can wait a minute or two. And then after you wait a minute or two, just gradually just get up and slowly walk to the toilet. If you run to the toilet, you're going to lose urine because that's a different nervous system that kicks into. There's, cues that, fight or flight where you're just rushing. That'll make you lose urine. So you can do that. And then once you're able to prolong, delay going to the toilet for 2 minutes, try to make it 5 minutes the next time. And even at night, if you can say to yourself, if you're getting up a couple of times at night to go urinate, which happens during the end of pregnancy, you can just say to yourself when you wake up, if you're not feeding the baby, is, self, let me see if I can fall back to sleep. And quite often you'll be able to fall back to sleep and you'll break that habit of disturbing your sleep pattern by needing to urinate. And then some women also have what's called fecal incontinence, where they can have some of the fecal matter that they see like a stain or something on their panties that also needs addressing. And that's something a physical therapist can help you with, and the right exercise program. A lot of women have sexual dysfunctions. They can have pain. Right after birth, your libido is like thrown out, and that continues while you're lactating. For some reason, the hormones that are produced during lactation periods kind of really lowers the want or need to have sex. So don't be surprised if that happens to you. Sometimes there's tissue injury from delivery where you have a tear, muscle spasms. So all of that can be worked on to kind of help break up the pain so that you can hopefully engage in sex again. A lot of women after delivery have vaginal dryness. Now you can try over-the-counter lubricants, but what works really well, as long as you're a candidate for it, is estrogen cream. So it's a cream that you insert into the vagina. It kind of drips down overnight and it just makes everything like absorb moisture better. And so that's good for the muscles, and it is also good for the vaginal dryness. And when you're lactating, you have a lower level of estrogen, and a lot of lactating women have very dry vaginas, and it's extremely painful to even think about sex, not even to try. So that's something to consider. And vaginal cream is something you have to ask your doctor or midwife to prescribe to you so that you can have it. And they just have to make sure that you're a candidate for it. Then fitness level and exercise. So I've had a lot of people just before delivery saying, I'm going to start right away. I'm going to go back to Soul Cycle. I'm going to do this. I'm going to do that. And it's like you got to take step by step and a gradual reentry. And what you can first do right after birth is I have like a rule where try not to lift anything heavier than your newborn baby for the first 4 to 6 weeks. That's really hard if you have a toddler because they're going to be a little bit jealous and they're going to want more attention. So one of the things you can do that I did with my older daughter is we created what was the cuddle chair. So there was a chair in the house that was really comfortable that I didn't nurse the baby in. It was only for my toddler and me to be in. So she would want me to pick her up and I'd be like, I would say to her, let's go to the cuddle chair. So we would go sit and she would climb on top of me. I actually also used it for changing her clothes and things like that so that I didn't have to lift her. You can start a walking program right after delivery. After my first baby, I didn't have an epidural during the delivery process, and I was kind of surprised at how it felt, and I wanted to get out of the room. I delivered a while ago. They used to just show you the baby and then, bring the baby to the nursery. There wasn't skin on skin contact. And so what I did is right after I delivered the placenta, I got up and I started walking out of the delivery room. And my doctor's like, what are you doing? You have to sew you up because people used to get epidurals then. So you can start walking right away. You can start with mini walks. Even if you had a C-section, my daughter did, and I actually had her like walking in the room back and forth. I had her take a very early shower where we made sure the incision was covered to kind of make her feel better. And your goal is to get to a 30-minute walk daily. Doesn't have to be outside to start with. You can start with 3 or 4 little mini walks that might be anywhere from 8 to 10 minutes. And it can just be in your home where you're walking up, up and down a hallway, just to get your body moving. And you can also do things, and I'm going to give you examples today on doing some very gentle stretching starting from day one, even if you had a C-section, and you want to avoid, as I mentioned before, any behaviors that cause breath holding. Later on, as you get stronger, then you'll be able to do things that are a little bit harder, like heavy lifting and stuff where you do have to hold your breath when you're about 2 months postpartum. So I was very against sit-ups, even though I do have my patients do sit-ups during a certain point in time when they're ready for it. But a lot of people think, well, if I do sit-ups, that'll close down the diastasis, meaning bring the 2 six-pack muscles together and also make the deeper core muscles work. And it actually can work against you. So if you see this picture, she's kind of curling up into a crunch. And if you look at the arrows are actually pressing down towards the pelvic floor and then up the abdominals. So that'll further separate the abdominals and can make things like a pelvic organ prolapse worse, or urine incontinence, because you're putting, or any incontinence, because you're putting pressure on the pelvic organs like the bladder and rectum. So you want to make sure that you're exhaling to match your task. So when I start women with doing things like crunches, they've already done a bunch of other exercises to help get the deeper core muscles to stabilize before trying to do something. This is actually advanced, even though people think that's, something that they want to do right away. So there's an endurance problem where what we call global training. So instead of getting the deeper muscles to work for you, if you're doing sit-ups the wrong way or too early, is that you're actually going to weaken the deeper abdominal muscles and over-strengthen the outside muscle system. So you have, if you think of your muscle system as having 2 layers, the bottom layer is the one that kind of stabilizes, they're called core muscles, that you really want to encourage to work. And this behavior of sit-ups will work against you, and you don't want that. So we're going to have a couple of demonstrations. I'm using some videos. I have a program that hasn't been published yet, but it's the Baby Bod program. So I have some of the videos from that. And then I did a video this week on some of the things you can do while you're in bed, right after delivery to make yourself feel better, which are mostly stretching exercises. So this is the rib expanders, where you can use an old tie wrapped around your rib cage, which I do the demonstration where I have somebody in the video doing that, or you can even put your hands at the side of the rib cage. So what becomes limited is your ability to breathe in and to expand that rib cage towards the sides. So you want to do that because that will help the deeper parts of the diaphragm work more efficiently to kind of hold everything together. So here we go. Here's the exercise. Rib expanders. For this exercise, use an old tie or a long cloth like a scarf. Stand in front of a mirror, take the tie and wrap it around your rib cage. Cross it in front and tighten it a bit with your hands. As you breathe in, feel the tie expand. Look at the tie expanding in the mirror. As you breathe out, tighten the tie or scarf and see in the mirror how your rib cage becomes smaller. Breathe in, look at the mirror and see the rib cage expand. Breathe out and see how it contracts. Breathe in, expand, breathe out, contract. So, and you can do these breathing exercises when you're pregnant also. And a lot of times that'll help with mid-back pain that a lot of women experience. So let's go for another breathing exercise. And this is for the lower tummy. After birth, your lower tummy, even if you had a vaginal delivery, is in shock because it's been overstretched during pregnancy. It had to carry a lot more excess weight for many, many months. And then all of a sudden you deliver, and then you have the contractions of the uterus and everything else going on, so that the muscles can become very tight and inefficient. So you want to do this breathing exercise right after birth. And it also is great. It helps to relieve pain, discomfort, and it will help you get into better alignment. Lower tummy breathing exercise. Place one hand on the bottom of your rib cage and the other hand on your lower tummy. I want you to imagine that you have a pipe running from your throat down towards your lower tummy. And at the end of the pipe is a small little balloon, about the size of a pair of rolled up socks. I'd like you to try to take in some shallow breaths, not deep breaths, and watch your lower tummy go up and down. Imagine that balloon, the size of a pair of socks, is expanding very slightly and then contracting. Do this for about 2 to 3 minutes and try to do it 1 to 2 times a day. You don't have to do it just lying down. You can also try it in sitting, standing, or while doing some of your daily activities like waiting for a pot of water to boil or watching a TV commercial. Okay, and you might be surprised, but lower tummy breathing can a lot of times help with neck pain, especially if you're doing it lying down. It helps you breathe from that section of your body rather than what you learn during pregnancy is to breathe mostly from the muscles just around the neck to pull the rib cage up. And that breaks up some of the pain that you can feel in the neck and the neck muscles being tight. So it's an overall great thing to do, and it relieves pelvic pain. It's great to do prior to having sex if you're having, some discomfort, if that may be orthopedic, not the dryness, but for other, reasons if you have tight pelvic floor muscles. So here's a little video on exercises you can do in bed, day one, even if you have a C-section. So it's just some gentle stretching to kind of like help you feel better. So let me give it to you, and hopefully other women will make use of this video. There are a lot of exercises that you can do right after childbirth that'll help you feel better. And you can do these even if you have a C-section. So that's a sitting rotation where you just twist, and you can twist enough so that you feel like the turn in your mid to upper back where your broad clasp is. It's a great stretch. Side bends are another great stretch that you get really stiff right after having birth. And if you're in bed a lot, these are things that you can do to kind of help get those joints moving and increase the what we call lotion in the fluids in the joints. So I'm turning, and I'm actually at the end of a turn, I'm using my hand to kind of push my head further, but it's all gentle. So I'm moving into it and out. I'm pushing, I'm also doing some lateral side bends where I'm dropping my ear to one shoulder, then I'm dropping on the other. And you can see my hand, I'm giving it a little bit of an extra pull at the end of the range. Then I'm taking my two hands and pulling my neck down or my head down towards my tummy, and then some chin tucks. And these look simple enough, but they feel really good. This one's really good for a muscle called the scalene. So what you're going to do is turn your head and pretend you're smelling your armpits. And you can do an over pull. Do things like pulling one knee to your chest and straightening the other one to help loosen up those hips. If you have a C-section, you might have to wait a couple of days for this one. So you go according to how you feel. And then you can do things like bent knee drops from side to side. So it's a little bit of a stretch in the tummy. If you have a C-section, you go to the point where you feel that you can go, that there's not too much stretch on the incision. This is a figure 4 stretch where you bring one knee towards your chest as the other one is bent. And you can see this one right now is the stretch is on the figure 4 leg, not the leg that's being pulled. And that's a nice quad stretch. So you can do that all in side lying. So all of this can be done in bed. You can do this, a lot of these on a chair even, or if you can get up and down off the floor, you can do it there also if you have a nice clean mat that you feel comfortable on. And then with the figure 4 stretch, you can also do rotations. This is great for the SI joint, which I mentioned is the back of the pelvis, which can get really stiff. And most of these, you can do these all during pregnancy as long as you have the ability to move the leg around the belly. And again, you use common sense, which is if it's hurting, you skip it. And that's it. I'd love to answer any questions you have. And let me see if I escape from this, what happens. All right. I'm not sure what happens. So I'm going to just leave this on this page because I'm not sure how to just get the questions up. So go ahead and please ask me any questions that you have. So we don't have that many participants, but if you have a question, you can. If you don't want to ask during this Zoom, you can also find me and send me a text either through Instagram or even my email address. I'd be happy to help. So good luck, and that's it for today. Bye-bye.
Thank you.
You're welcome. Okay. All right. Bye, everybody. Thank you for joining me.